Hello, everybody. Welcome once again to the Real Results Show. I am super excited to have Brandi Hensel with me today, and we are going to talk about reaching for remission. So I'm really kind of excited to dig in and talk about all of this. We are going to be giving away, I have a special gift for you guys today. It's called the brain body diagram. It is a video and it is a new way of looking at disease. So I definitely want you to drop the word coach, or I lied, it's not the word coach. It is the word reach. Drop the word reach below the video. Reach is the magical word today. And we are going to send you that brain body video, and you don't want to miss it because it's really going to be eye-opening for you to look at that new way of looking at disease. So my name is Piper Gibson. I am your host and Director of Course Enrollment for Functional Diagnostic Nutrition. And this is the Real Results Show, where every week we talk to real health coaches and practitioners getting real results for their clients and for themselves. So I would love to know where you guys are joining us from. I see Dr. Nambasi is on. I see Patricia Kobe is on. So I'm really excited for everybody joining us today. Brandi, thank you for joining us today. How are you?
I'm good. Thanks so much for having me. I'm doing really good.
Good. I'm excited to dig in with you today. We chatted a little bit before we got started. So I would love to know what prompted you to become an FDN in the first place.
All right. So I am a registered pharmacist, currently practicing just part-time, but I realized my dog is dreaming behind me. I realized that ultimate focus with my patients or with my clients was going to be to get them healthy so that I could help get them on the path, better health completely. And I realized that I wasn't doing that. Practicing every day, full time for years, behind the counter as a pharmacist, I didn't have the time to spend with people. So I reached a point with my own health that I decided it was time to make a change. And it started with me, ultimately. And I was just kind of, I don't know, I was like in the social media scroll loop one day and came across a fellow pharmacist who had these letters, these credentials at the end of her name, FDN-P. And I was like, what is she doing? And I happened to see her. I looked into it more and I was like, this is my path. So I enrolled.
Awesome. And how long did it take you to get through the course?
Ended up probably being about between like 7 and 8 months by the time I got through everything.
And when did you graduate?
February 2019.
Awesome. So
yeah,
you've got a little over a year under your belt, year and a half. So
I do.
Fantastic. Well, we get a lot of questions and a lot of people who are practitioners, medical practitioners, licensed, registered practitioners. And I want to dig in a little bit and talk about how you have incorporated FDN into pharmacy life.
Yeah. So initially in my practice setting, I was in a very, very busy pharmacy. I didn't have much help. So initially, when I graduated, I had a really hard time putting it into practice in my current position. I switched from one of those big box stores into an independent pharmacy. And actually, it's been a lot easier to have those one-on-one conversations just with the patients, whether it's a new medication or a recurring medication, just talking about their health in general or symptoms. And in independent pharmacy, it seems like it's a lot easier to have those conversations with people because we have the time. How are you doing today? How are you feeling? What's new? What's exciting? And it really opens the door to some of that. And the pharmacy that I'm currently working in focuses on hormone replacement therapy. So it's a great opportunity, if someone doesn't want to do, a hormone test with their practitioner, with their OB or whoever, and they want to do it through us. It's easy, it's convenient. We can order it. We can We can interpret the results and kind of let them know. And we actually have great relationships with some of the doctors. So we can send them a request and say, here's a copy of the results that we got. Here's what we're thinking as far as, hormone replacement therapy and making that recommendation.
That's fantastic. So how has using lab testing and that FDN approach really helped to solve your clients' issues or even your own issues? I know you said you wanted to.
Yes.
Your own
So me personally, I kind of got to a point with my career where I hit, I was experiencing chronic stress and burnout. And sometimes, and I've noticed it with some of my clients as well, people like to see, as much as it hurts, people like to see those results on paper. They want to see it and not just be told that something is a certain way. So, when I came across Reed and the FDN model and all of that, and it was test, don't guess, I feel like sometimes as a pharmacist, it's like, well, it could be this, or it could be this, it could be this, but I actually have the ability to test with my patients. So, or my clients. So it's really easy. When I saw my own burnout, it hit me hard because it was confirmation, but it also made me realize personally that that's what I had to work my way out of, the problems and the stress and everything that I had done to my own body through my profession and my career. But clients really like to see it on paper because that's their results. They know that they either did the saliva test or the urine test. They cut their own hair. So they know it's theirs. They didn't give it to me. I didn't transpose anything. Those are your results and it's on paper. And this is what it means. Yeah. So it's been really nice to have that as a tool when working with my clients.
And I love it that you can incorporate both of those things together, the FDN and the pharmacy. And I think that's fantastic. So we've got several people watching. We've got Dr. Nambasi, Patricia Cove, Angela Henry Brown says, love it, Brandi. You have definitely found your path.
Thanks, girl.
One of the hot topics that we have heard a lot about is working as a health coach in Florida. So let's talk a little bit about Florida and working in Florida and some of the cool changes that have recently happened.
Yeah. So initially, when I first got certified as an FDN, Florida was known as a red state. And that basically meant that I couldn't do anything nutrition wise. I couldn't step on the toes of like a registered dietitian that was licensed by the state. So I couldn't provide that one-on-one or group coaching with my clients without risking legal ramifications. So there was something a couple years ago about a health coach that did get in trouble for it. And as a result, things in Florida have changed. And the law actually, like a month ago, just changed. So instead of being a red state now where we have those restrictions, now we're a green state. And what that means is that we have the green light to go ahead and work with our clients as long as they are not working with a doctor under medical nutrition therapy. Meaning if a doctor has referred a patient to a dietitian for a particular reason, whether it's like chronic kidney disease or diabetes, as long as that client is not specifically working with a practitioner for those reasons, then we can work with that practitioner or with that client one-on-one.
That's awesome. And that's really good news for everybody that's in Florida. So I just wanted to touch on that. Absolutely. I want to talk about, because we've got some FDNs on here who are chiming in and talking about that you found your path. I want to talk about how the FDN community has really supported you in your business and health endeavors.
Oh, the FDN community has been fantastic. I know last week Angela was saying that you could search in our group for anything and you can find any answer. But if you don't find it and you post your question in the group, the FDN community is so well versed in what they do, whether, you know, they work with a specific disease state, or they work with, you know, a whole bunch of people. The community has been fantastic at answering questions, providing resources, and really being there to kind of help new grads or, you know, former grads kind of get their feet wet and get the answers that they need to help their clients. You know, really at the end of the day, we are a support community to help our clients.
Yeah. Love the FDN community.
Mm-hmm.
Do you have a niche or ideal client, people that you really focus on working with?
Yeah. So I recently pivoted my business actually from chronic stress and burnout to lupus. And the reason I did that was because I lost a friend, a really close friend, back in December of 2018 to lupus complications. And, you know, looking back, I can't believe everything happened the way that it did, and that it led to, you know, ultimately her death. And I kept having this calling, like this voice in the back of my head that just kept saying, you know, what about lupus? What about lupus? Why don't you work with people, you know, with lupus? And I decided to pivot. I was like, you know what? I can't go another day knowing that maybe someone else out there is going to go down that same horrible path as my friend. So I decided to work with women who have been diagnosed with lupus, who are really looking to stop being told that there's more problems that they have to deal with, and really want to boost up their immune system so that they can stop having those unpredictable flare-ups and get ready or get back to feeling, you know, pain-free and energetic and fearless, because there's so much fear with that diagnosis. So I've pivoted.
I love it. I love it because everybody that is an FDN has really found that specific ideal client that really they are passionate about. And I think that we can all go through the FDN course and we can all learn that same skill set and use it with anybody.
Yeah, the FDN course is really a great stepping stone to building your own business. You know, it gives you a lot of great foundational tools and knowledge to just really, you know, take our clients to the next level with their health.
Absolutely. So I know you mentioned that you do pharmacy part-time. When it comes to the FDN, or when it comes to working with all of your clients, do you do in-person? Are you virtual? Are you both?
I'm mostly virtual. I have done some in-person, but I find that those meetings are a lot longer than the virtual meetings, because we, you know, we'll have lunch or drinks or, you know, coffee or whatever, coffee, tea, get into conversation. So most of it's virtual.
And I would love to have you share how interview listeners watching can get in touch with you, your website, your social media. How can they find you?
Yeah, so like I said, I am pivoting with my niche, but my website is just brandihensel.com. You can go to that and kind of see what I've put together so far. I can be found on Instagram, where I do most of my posting. It's just dr.brandi Hensel. And I am on Facebook at Brandi Hensel, PharmD, FDN-P as well. And I'm working on a YouTube channel, so that is in my future.
Yay, me too. Me too.
Yeah.
That's something that is on my list. So
yeah,
see you on YouTube.
I'll see you there.
Do you have a number one tip, tool, piece of information that you learned from FDN that has really just made all the difference in your own personal health, or even, you know, the health of your clients?
I'd have to say that one of the biggest things that I didn't understand going into the FDN program, and I definitely work with my clients on trying to understand too, is the idea behind conventional versus functional lab ranges, and what's normal and what's not normal, you know? So typically, just as an example, so when you go to the regular doctor and you have your lab work done, they come back with values that are between a range. And these ranges vary, they're very big, they're very broad, but they don't mean healthy. Inside that bigger range is a smaller range that signifies healthy or healthier. And everything between those functional ranges and that conventional range is typically a trend, one way or the other. And so it's trying to get clients to understand that just because those labs that your doctor said are normal, because a lot of times people go to the doctor, they get the labs done and they feel like crap, but the doctor says, everything's normal. I don't know what's going on. I don't know what it is. I try to explain that you're trending one way or the other, and that's why you feel the way you do. So
yeah, I think that's a great part of FDN is really that focus on those functional ranges, that more narrow range taken from people who really are feeling their best, who are experiencing their optimal health. And when it's outside of those ranges, you can see, like, are you trending high? Are you trending low? Like, what path are you on?
Mm-hmm. Yep.
Absolutely.
Where are we going?
Yeah. Do you have a piece of advice you would like to share with health coaches or professionals who might be watching?
I can speak to other pharmacists or that are out there that are maybe thinking about transitioning to a health coach role, that it is possible. Number one, we aren't stuck in our license. And a lot of times I heard it very early on when I was in pharmacy school, that a lot of people go into healthcare for the ultimate goal of helping people. We're looking to help people get healthy and be healthy. A lot of times, I just lost my train of thought. But it's what can happen. Our industry right now, the world of pharmacy, is very unpredictable. We are very saturated, and it's definitely affecting jobs. So I'm more than happy to speak to anyone one-on-one that is looking to pivot maybe into whether it's a part-time or a full-time health coach position. I can certainly give you my experience, talk more about the FDN program specifically, and let you know what options are so that you don't get stuck being one of those pharmacists that's being laid off, or having trouble finding another job or something like that. So it's definitely an opportunity to really truly get out there and help people in the right way.
And something else that is really awesome about FDN, and great for you, especially someone who is registered, licensed, is that being an FDN, you can work as a health coach with people all over the world. You're not just stuck in Florida.
Mm-hmm. Yep. And, initially when I was starting, I was like, okay, well, because I'm in a red state, I'm going to have to work with people in green states or yellow states and try to bypass that. But there's more and more green states out there that allow you to really do the work.
Yeah.
There's those workarounds as well.
Absolutely. Do you have something you would like to share with people who may be struggling to get their own results?
Yeah. So if you are struggling to get your own health results, and you have not yet worked with an FDN, then please reach out to someone, whether it's myself or the FDN team, that can put you maybe with someone who's specific to something, whatever you're struggling with. But working through the functional medicine lens has gotten a lot of people relief and a lot of people results, and kind of put people in remission, so to speak, for a lot of the problems that they're seeing, whether it's a weight loss situation, an autoimmune disease, it could just be, Lyme disease, something else, just hypertension, diabetes, anything. Just kind of getting back to some of the basic skills of functional medicine is really going to help you. So don't hesitate, reach out. FDN Community is a great place to start to help you get relief.
Everybody that's watching, I see we have several people that are still watching. If you've not dropped the word reach below, drop the word reach, and we are going to send you our free gift today, which is the brain body diagram video. You don't want to miss it. It's going to be a great way for you to really get a good idea of how the brain and body is all connected and how that falls into that functional perspective. Brandi, one more time, will you tell everybody how they can get in touch with you?
Yeah, so you can either connect with me through my website, which is brandihensel.com, Brandi with an I, BRANDIHENSEL.com. I can be found on Facebook at Brandi Hensel, PharmD FDN-P, or on Instagram at dr.brandihensel, dr.brandihensel.
Brandi,
and you can send me a DM or a message or email or anything. Message me below, I'll message you back. It's all good.
Awesome. Brandi, thank you so much for coming on the show and breaking it down. It was great to talk to you. I'm always sending people to you with questions. So awesome to talk in person. And, I thank you so much for coming on.
Of course.
I will be back next week, same time, same place for another Real Results show. Next Tuesday, we will definitely be on for a Health Coach Tip Tuesday. So thank you everybody for joining us today. Drop the word reach below. And if you have any questions, absolutely drop those below as well. And we will definitely get to those. So thank you guys. Thank you again, Brandi. And we will see you.
You're welcome.
Bye.
Bye, guys.